Today I'm going to talk to you about a diet for chronic kidney disease patients on behalf of the Kidney Foundation of Western New York. Diet planning is very important for patients with chronic kidney disease. Once patients have been identified as having kidney disease, they should begin working with a nephrologist. The nephrologist can monitor kidney function in order to determine if your kidneys are deteriorating. In addition, nephrologists can work with you and a licensed dietitian in order to put you on a diet that can reduce the risk of your kidney disease turning into actual kidney failure. What do you need to change in your normal diet when you have a chronic kidney disease diet? You need to decrease your protein intake, decrease your intake of sodium, decrease your intake of phosphorus, and decrease your intake of potassium. Protein can build up in the body and create toxins. It is important for people that have chronic kidney disease that are not on dialysis to limit their intake of protein because their kidneys cannot effectively remove the toxins created by protein in their body. The recommendation for protein intake for patients that are not on dialysis with chronic kidney disease is 2 3-ounce servings of protein a day. A 3-ounce serving of protein basically looks like your fist. Patients experiencing chronic kidney disease have a buildup of sodium in their system. Too much sodium can lead to complications such as fluid retention and increases in blood pressure. It is important for patients with chronic kidney disease to aim for 2,000 milligrams of sodium or less per day in their diet. Patients experiencing chronic kidney disease can also have a potassium buildup in their body. Too much potassium can cause a person to have heart complications that could prove to be fatal. Potassium intake should be limited in patients with chronic kidney disease. Phosphorus can also build up in the body of patients experiencing chronic kidney disease. Too much phosphorus can actually pull calcium from your bones and create bone disease. Phosphorus intake should be limited by patients with chronic kidney disease as well. What are sources of all these nutrients? Sources of protein include meat, fish, chicken, eggs, nuts, dairy, and grains. Remember, protein should be limited to 2 servings of 3 ounces per day. Major sources of sodium in the diet include table salt, canned foods, processed foods, and prepackaged foods. Try to limit sodium intake by using spices instead of salt to season food and preparing fresh food. Major sources of potassium include tomatoes, potatoes, bran cereals, dairy, whole wheat grains, breads, and pasta, beans, and nuts. It is ideal for chronic kidney disease patients to limit their intake of foods containing high amounts of potassium. Sources of phosphorus include meats, fish, bran cereals, oatmeal, beans, nuts, lentils, sodas, fruit punches, and iced teas. Patients with chronic kidney disease should limit their intake of foods containing high amounts of phosphorus as well. How can you take control of your diet? Read labels, understand portion control, and keep track of food. Reading labels is very important when you're on a chronic kidney disease diet. Labels tell you how much a serving size is and what nutrients are contained in food. In many cases, protein, carbohydrates, and sodium are listed on nutritional labels. In some cases, potassium and phosphorus content will be listed on the label as well. It is important to work with your nephrologist or dietitian to understand the amount of each food substance you're supposed to have in your daily dietary intake. It is important to keep track of foods you eat so you're meeting your daily food intake goals appropriately. So dieting on a chronic kidney disease diet doesn't have to be boring. There are many recipes available online that can make being on a kidney-friendly diet tasty and fun. This Tex-Mex wing recipe was taken off of the Game Day Favorites cookbook on the DaVita.com website. It's easy to make using chicken wings, barbecue sauce, honey, green chilies, chili powder, and cumin. Only you can control what goes in your mouth. So make wise, healthy food choices that follow your chronic kidney disease diet plan. And for more information, contact the Kidney Foundation of Western New York.